Hi everyone, welcome to Lamp Clinics featuring Common Cold, presented to you by Lamp AccuWellness Foundation Inc. We have a 43-year-old female whose chief complaint is bad cold. 1 month ago, the patient had a bad cold and has not recovered. She has a feeling of being always cold, with an aversion to wind and spontaneous sweating. She has a cough with a little sputum but no sore throat or fever. She has general lassitude and fatigue and cold extremities. She is not thirsty. Food intake, bowels, and urine are normal. The patient has a weak general constitution, easily catches cold, always feels cold, and prefers to wear more clothes than other people. Tongue body is pale with white moist coating. The pulse is sunken, thin, and forceless. Analysis of symptoms. Aversion to wind means invasion of the superficial tissues by pathogenic factors. Spontaneous sweating indicates dysfunction of the pores. Cough with sputum is a manifestation of stagnation of lung qi. Fatigue, general lassitude, a feeling of being cold, and cold extremities all point to yang deficiency. Pale tongue with white coating denotes cold pattern. Sunken, thin, and forceless pulse indicate yang deficiency. Invasion of the body by any external pathogenic factor tends to run a similar course. The onset is acute and the patient recovers naturally within 1 or 2 weeks. The history is short and the nature of the disease is excessive. In the case of a patient with a weak constitution, the anti-pathogenic factors are not strong enough to expel the pathogenic factors, so they are retained on the body surface. The disease is therefore prolonged. This type of problem is both deficient and excessive, and represents an important concept in Chinese medicine known as externally contracted disease with a deficient anti-pathogenic factor. This means invasion by pathogenic factors with a pre-existing condition of deficiency. Cause of disease is pathogenic wind. The patient has a history of easily catching cold and presently has an aversion to wind with spontaneous sweating, implying that the protective qi has been injured by the pathogenic wind. This patient has no fever. Site of disease, superficial tissues, yang qi. The aversion to wind and the spontaneous sweating indicate that the pathogenic factors have invaded the superficial tissues. The feeling of being always cold, with cold extremities, fatigue, and general lassitude are evidence of a disorder of the yang qi. There are two aspects of pathological change in this case: the underlying internal problem and the invasion by external pathogenic factors. The yang qi of the body includes primary qi, which is also called yuan or source qi, pectoral qi, zong qi. nutrient qi, ying qi, protective qi, wei qi, the qi of the organs, and the qi in the channels and collaterals. In Chinese medicine, qi is thought to exist in several forms within the body, each serving a different purpose. Qi is classified based on its role and production, distribution, and functional characteristics. Each of the Zangfu organs has its own qi, which can be separated into yin and yang components. Qi has 6 primary physiological functions: transforming, transporting, holding, raising, protecting, and warming. Protective qi is part of the yang qi of the body, which has the function of warming and nourishing the surface of the body, controlling the opening and closing of the pores, and preventing invasion by pathogenic factors. Deficiency of protective qi weakens the resistance of the body to disease such that pathogenic factors frequently enter it. The patient readily catches cold and recovery is slow. The ability of the yang qi to warm the body is reduced, thus the patient constantly feels cold and wears more clothes than would a healthy person. After invasion by pathogenic factors, the yang qi is further consumed, causing the patient to have cold extremities. When there is a deficiency of yang, the patient will lack energy and suffer from fatigue and general lassitude. The patient will not be thirsty and may drink less than usual because yang deficiency leads to a pattern of cold in which the body fluids are not consumed. In this case, the main external pathogenic factor is wind. Although wind and cold frequently invade the body together, they have different characteristics. Wind is yang and has a tendency to expand, causing the interstices and pores to open and the body fluids to flow out passively. The main symptoms are therefore an aversion to wind and spontaneous sweating. Cold is yin, tends to consume yang, and constricts the interstices and pores. Associated symptoms are an aversion to cold with an absence of sweating. Here, there is an aversion to wind and spontaneous sweating, so the wind has invaded the surface of the body. The presence of this pathogenic factor in the superficial tissues causes stagnation of protective qi, which in turn impairs the dispersing function of the lung qi. The patient, therefore, has a cough with sputum. That she has no sore throat indicates that there is no heat present. The pale tongue with moist white coating indicates the presence of cold. The thin forceless pulse shows a deficiency of yang, as there is not enough qi to move the blood. The pulse is sunken because of the yang deficiency. Antipathogenic factor is too weak to rise to the body surface and fight with the external pathogenic factors. Generally speaking, a patient with an exterior pattern of disease will have an aversion to either cold or wind accompanied by fever. The fever occurs because the stagnant protective qi transforms into heat. In this case, the patient suffers from internal cold caused by deficiency of yang qi. Thus, after the invasion by pathogenic factors, although there is stagnation of qi, it is not strong enough to transform into heat, and consequently, there is no fever. The patient has yang deficiency. and this weakens the protective chi, and this causes the body to lose warmth. The pathogenic factors have invaded the body surface, thereby weakening the protective chi further. So the protective chi cannot reach the surface, and now we have aversion to cold or exterior cold. The yang deficiency pattern of the patient causes the body to lose warmth, and therefore we now have an interior cold. Cold pattern is both inside and outside, and there is absence of fever. The patient has an aversion to wind and spontaneous sweating caused by invasion of pathogenic factors. She also has yang deficiency with a feeling of being cold and cold extremities. There is thus both an exterior and an interior pattern. There is no fever, but she has a pale tongue with white coating and complains of cold extremities. So this is a cold pattern. There is also yang deficiency with a feeling of being cold, general lassitude, and a thin forceless pulse, indicating a pattern of deficiency. Usually, when there is invasion by external pathogenic factors, the onset is acute, the history is short, the pathogenic factors are expelled, and the patient recovers. If this does not occur, the pathogenic factors penetrate more deeply and transform into interior heat, with a corresponding worsening in the patient's condition. In this particular case, the patient has yang deficiency. Thus, the body resistance is too weak to expel the pathogenic factors. At the same time, however, because there is internal cold, there is no reason for the symptoms to transform into a pattern of heat. There is thus a stalemate in which the pathogenic factors are retained on the body surface and the yang deficiency fails to improve. Is this a case of qi deficiency or yang deficiency? Both qi and yang deficiency can lead to deficiency of protective qi, a condition in which the patient can easily catch cold. This patient has spontaneous sweating, general lassitude, and fatigue, symptoms which are typical of qi deficiency. But she also complains of cold extremities and constantly feeling cold. The correct diagnosis is therefore yang deficiency. Conclusion. According to the 8 principles, this is exterior and interior, cold and deficient. According to etiology, this is invasion of superficial tissues by pathogenic wind. According to yin-yang theory, yang deficiency. Treatment principle. Expel the pathogenic wind, remove the exterior pattern, tonify the yang, and resolve the interior cold. Selection of points. Conception vessel 6, Qi high with moxa box. Stomach 36, Zhu Sun Li with warm needle. Triple burner 5, Wai Guan, bladder 12, Feng Men. Conception vessel 6 is effective for tonifying the yang qi and strengthening the kidney. It also regulates the qi of the entire body. Stomach 36 tonifies the yang qi of the entire body, strengthens and harmonizes the middle burner. Bladder 12 expels pathogenic wind and cold and relieves exterior conditions. It also regulates the qi around the greater yang channel. Triple burner 5 is a meeting point of the triple burner with the yang linking vessel and is used to improve the circulation of yang qi on the body surface to aid in expulsion of pathogenic factors. Combination of points. Conception vessel 6 and stomach 36 are both very important tonifying points. Conception vessel 6 is closely related to the kidney and stomach 36 to the middle burner, both of which are important sources of qi. When moxa is used, this pair of points tonifies the yang of the body. Triple burner 5 and bladder 12. Triple burner 5 assists the yang qi in reaching the body surface. Bladder 12 is effective in removing the wind and cold. With regard to the moxibustion used in this case, the warm needle technique was accomplished by using 3 pieces of moxa stick on stomach 36. The moxa box was applied for 15 minutes on CV6. Moxa and stomach 36 are the secret of longevity. One of the most famous preventative moxa therapies is to do indirect moxibustion on stomach 36. Clinical research now posits that stimulating stomach 36 increases maximum oxygen uptake. It is known that increased maximum oxygen uptake prevents and improves recovery time from diseases such as hypertension and diabetes. Maximum oxygen uptake also decreases the cancer rate. Thus, we may assume that the modern idea of maintaining health by increasing maximum oxygen uptake is based on the same mechanism as our traditional wisdom for attaining longevity by stimulating stomach 36. Stimulation of stomach 36 not only enlivens the point, but also the entire meridian and stomach organ. According to this classic medical theory, the organ and meridian of the stomach are a part of the foundation of our life energy. Thus, stimulation on stomach 36 not only affects the leg, where stomach 36 is located, but also affects the health of the whole body. When you need to strengthen yang, conception vessel 6 is an excellent place to moxa. In case of collapse of yang, use on a slice of ginger for added effect. After 3 treatments, the aversion to wind and spontaneous sweating had been resolved. Because the pathogenic factors were no longer present, the treatment regimen was changed in order to tonify the anti-pathogenic factor and promote the body resistance. The following points were used: lung 9, stomach 36 with warm needle, CV6 with moxa box. The patient was treated twice a week for a month, after which she had recovered completely. She continued to use a moxa stick at stomach 36 for 10 minutes each day on both sides for 2 more months. She was instructed to hold the stick 4 to 5 centimeters above the skin and to move the stick horizontally with small circular motions. Thank you very much for your attention and hope to see you in our next videos.